What happened to Pap smears? I know, talking with docs, here we are. I'm Dr. Brad Weening.
I'm Dr. Paul Zalzal.
And I'm Dr. Sandy Andrighett.
We have really evolved this channel. We started talking about knee replacements and hip replacements, I don't know, 7 years ago.
Yep.
Now we're talking about Pap smears. Thank God we have an expert to discuss that with us, Dr. Andrighett. Thank you so much for your expertise in sharing this with everybody.
Thanks for having me.
Okay, so we're talking about what a Pap smear is, why you need one, and why the pandemic has changed things and what the future looks like for the Pap smear. So let's start with the test itself. Why does someone need a Pap smear? What is it?
So a Pap smear is looking for cells that may indicate an abnormality of your cervix. So some people think it actually, once they have a Pap smear, it's ruled out all cancers of the genitals, and it doesn't. It's just really for the cervix. So that's the sort of the neck of the uterus that connects the vagina to the womb or the uterus.
Okay.
So that is, now Pap smears per se are becoming less used and being replaced by another investigation. Is that true?
Well, they're being used together for some things, and there's changes in different parts of the world. Some people won't do a smear where we just collect some cells. So we can start with how it happens is that there's a tool that we use that helps. The vagina is a closed space, and to see the cervix, we have to open it. So just like if you go to the dentist, you need to open that space so you can see the cervix, and you need to see it well.
Okay.
And there's a soft brush that we put, and we collect just a collection of cells, goes into a fluid, and it goes to the lab.
Okay, so it's not the scraping that we've heard so much about. Oh, they're scraping scraping your cervix.
It may for some women be uncomfortable and feel like a scraping, but it's really a soft brush now that we have that we use.
How long does this test take?
Less than a minute.
Okay, so it's really, you just have to endure some discomfort, but it's something that's really, really worthwhile.
100% worthwhile.
Okay.
Absolutely, life-saving.
And the purpose of this test is?
The purpose of the Pap smear is to find these cells that might indicate there's a change going on, that the cells are undergoing change. Just because they're abnormal doesn't mean it's cancer, but it does mean it needs further investigation sometimes, depending on where that abnormality lies.
Okay, so we're trying to screen and prevent for a cervical cancer. So we're trying to get some cells to look at under the microscope to determine if they are changing and looking like they may become sinister down the road and lead to cancer.
Exactly, because it's a slow process. So the cells, it can take up to 3 years for an abnormal cell to become a cancer. So that's why this is an amazing screening tool, because really, ideally, we should be eliminating all cervical cancer.
Okay, so should women get this test every year, every 5 years, and how old are you before you have to start getting this screening test?
Great question. So we used to do Pap smears as soon as you became sexually active.
Okay.
What that led to was a lot of over-intervention, and so women were having surgeries and procedures, young women, to their cervix. We've learned a lot. We've learned that a lot of cancer of the cervix is really HPV related, which is a virus.
HPV, human papilloma virus. And there's tons of different types.
Exactly. And we know that as humans, we have the ability to clear virus. So that's why we changed the age of starting to have your Pap smear to 21.
Okay.
Because young women who have a robust immune system can clear that virus almost 80% of the time.
Okay, so the odds of you getting exposed to the virus and getting cancer before 21 approaches 0.
Extraordinarily rare.
Okay.
There's going to be a soft launch in our province to start doing it at 25, in fact.
Okay.
And so now we're doing it at 25.
And that's yearly, every 2 years?
Every 3 years in our province. Changes around the world, but because you can clear it, what we don't want to do is identify it, have a reflex where you see a gynecologist and you have a treatment before you've had a chance to clear it.
Okay, so it depends on the area you live in, and the frequency and age of starting to do these tests depends on the frequency and prevalence of the disease in your region. So check your public health guidelines and see when you should be getting this test done. And now to our viewers who've connected the dots here, we're screening for HPV, which is an infectious disease, a human papilloma virus, and it is strongly linked to cervical cancer. So you're now maybe connected on and said, wait a minute, are you trying to tell me that cancer is an infectious disease?
It is.
It is. This type of cancer is actually an infectious disease, which means it's preventable, and that is why screening programs come into play.
And it's also highly prevalent. 80% of us have had HPV in our lives.
Right, this is men and women can be exposed to this virus.
Absolutely. So 80% of people have had at least one exposure to HPV in their life.
Right. Okay.
So a lot of the stigma of HPV is that they're, promiscuous or have multiple partners. Just having one partner means you should be screened for HPV.
Okay, and so historically we did the Pap smear, and then more recently testing specifically for HPV has become a thing.
Yes.
And so going forward, are we going to maybe get rid of the Pap smear and consider just doing the HPV testing?
Yeah, the HPV test is so amazing and
Okay.
sensitive. So what that means is it has a better ability to detect a problem than just the Pap smear alone.
Okay.
So there's a lot of cost issues and a lot of policy that has to happen, but in our province, it's going to likely replace Pap smear screening, but
So-
it's done the same way.
Okay, yeah, so the actual procedure is the same, but what happens after the cells are collected is going to change a bit. So can we stop calling it a smear?
Yeah, we stopped calling it a
That's
smear.
not
It's
called
not really.
smearing.
It's called a smear because we used to smear the cells on a slide.
Okay.
So now we put it in a small amount of liquid, and then the DNA gets extracted. It's
So we're going
quite
for
amazing.
a Pap dip now.
So now for our viewers that are watching, they said, well, I've had a Pap test or an HPV test, and I'm positive, but I don't have cancer. What does that mean for me now?
So that means depending on what the result is.
Yeah, so
and
you're positive.
You're positive. So
Yeah.
positive algorithm or this number of steps can be a whole number. If you have a very high grade or severe type, you would likely come see someone like me
Okay.
for a specialty test called a colposcopy.
Okay.
Not all gynecologists do colposcopy, many do.
Okay.
And what that is where we'll look at the cervix with a microscope, and that is sort of the gold standard. That's where we'll see if there's a lesion or something going on, and we take typically a sample of the worst area.
So a biopsy.
The biopsy is about the size of a half a grain of rice. So
Okay.
people often say to me, "Are you going to take chunks out of me?" And it's not. It's a tiny. It's uncomfortable.
Yep.
But it's important, and it's about the size of a half a grain of rice.
And because these are superficial epithelial cells that you're looking at, so they're
Correct.
right on the surface, you don't have to go very deep for them.
Correct.
Okay, now you mentioned types, and we mentioned there are hundreds of types. So if you hear that you have had exposure to HPV, there are some types that have a higher association with the development of cancer, and some types that have a much lower association.
Exactly.
That's what we're trying to say. So it depends on what type you have.
Right, and some types we can clear easier than other types. And
Okay.
some types might cause just warts. Some people get warts, but they're less likely to cause cancer.
Okay, and that's the HPV virus types.
That's an excellent summary of the Pap test. So I guess the take-home message is that you need to talk to your doctor about this, and you
Right.
probably should have one of these tests.
And the pandemic has really limited the number of people who have gotten their Pap smears.
Yeah.
So please remind yourself to at least discuss with your healthcare provider when was your last Pap smear.
That's awesome. And if you like this video, please like it, subscribe to our channel, leave a comment about your experience.
Dr. Andrighett, thank you so much
You're
for
very welcome.
enlightening us on
Thanks
the
for having
sensitive
me.
area. And hopefully if you were wondering about this, you're not wondering anymore. You are in charge of your own health.
We'll see you next time.